Hi, dear mom to be. You will agree with me that pregnancy is an amazing journey. Pregnancy is an incredible journey, but it comes with a lot of responsibility, especially when it comes to protecting your health and that of your unborn baby. And one of the best ways to do that is through vaccination. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, and today I'm going to be sharing with you the different types of vaccine I had in the UK and also the different vaccines that have been given back home in Nigeria when I was a midwife. Before I talk about the different types of vaccines that have been given in the UK and Nigeria, there's something I want you to know. That two different countries might have different vaccines they give to their pregnant woman, and this is based on different reasons. And one of the reasons I have to share with you is the prevalence of that disease and also the risk factors in that country. What disease is prevalent? What are they trying to prevent these pregnant women from in that particular country? Because generally, the disease you have in one country is different from the diseases you have more in another country. The disease that is prevalent in one country is different from the disease that is prevalent in another country. So the prevalence, the risk factors around that particular country determine what vaccines they are going to give their pregnant women. Then the second is the national immunization policy. What is the policy in that particular countries? Two countries differ when it comes to policy, same way their immunization policy differs. So the immunization policy in Nigeria is different from the immunization policy in the UK because they have different prevalence, they have different risk factor. And also another thing is that they are going to take into consideration is the country's infrastructures. Do they have the infrastructures to preserve these vaccines? Do they have this infrastructure to administer these vaccines? This is something that should be taken into consideration. Then another is the effectiveness and safety of the vaccine. How effective, how safe is this vaccine for the citizens? These are something that needs to be taken into consideration. Then the other point that you should consider when it comes to vaccination in a particular country is the cultures, the traditions of that country. The culture and tradition might not permit some people to take some particular vaccines, might not even permit some people to take vaccines at all. And also the stage you are in pregnancy, there are some stage you can't get a particular vaccines. There are some stage you can get a particular vaccine. And also what determines the vaccine an individual receive is the individual health needs. So that takes me to the types of vaccine I've had in this my course of pregnancy. So the first vaccine I want to share with you is the flu vaccine. Yes, the flu vaccine, as the name implies, it protects you from flu. You know, as a pregnant woman, your immune system is not as strong enough as it was to fight flu and other diseases that are likely going to come. So when you take this flu vaccine, it boosts your immune system to fight flu. So it's very important that you take flu vaccine and keep up with your appointment. This particular flu vaccine is usually given by the practice nurse. So our midwives don't usually give the vaccine. So you book an appointment with the practice nurse. The midwife tells you when to do that. Then you book an appointment with the practice nurse and get the vaccination. Then the second type of vaccine is the whooping cough vaccine. There's something I like about this whooping cough vaccine, and I will encourage all pregnant women out there to take the whooping cough vaccine. When you take the whooping cough vaccine, it builds this antibodies. These antibodies are transferred to your baby. These antibodies are transferred to your baby. And when your baby is born, these antibodies help your baby to fight whooping cough. It helps your baby to fight this in the first 8 weeks till they are able to take their own vaccine. So it is advisable as a pregnant woman for you to get the whooping cough vaccine. Appointment for my whooping cough vaccine was booked with my practice nurse when I was 20 weeks pregnant. So like I earlier said, I will encourage all pregnant women to get the whooping cough vaccine. They give it here in the UK. Then the other vaccine which they give in the UK is COVID-19 vaccine. I didn't really take COVID-19 vaccine, but you can take COVID-19 vaccine because as a pregnant woman, there is an increased chances of you having more illnesses, of being affected more with COVID-19, like the effect of COVID-19 to affect you more compared to those that are not pregnant. So if you can take the COVID-19 vaccine, I didn't take the COVID-19 vaccine, but I would advise you to take it if you want to. Then the last one, which is the recent vaccine in the UK, is the RSV vaccine. Yes, I was told to come for the RSV vaccine, I think 2 weeks after my whooping cough vaccine, because they said I can't get it immediately. So I took the RSV vaccine, the description, respiratory something virus vaccine. I'm going to put it in the description below. My brain cannot carry that at that particular moment. So these are the 4 vaccines that are given to pregnant women in the UK. Now let's talk about Nigeria. In Nigeria, I was a midwife, but I was never pregnant in Nigeria. My first pregnancy was in UK, and now my second pregnancy is still in the UK. So as a midwife back in Nigeria, there is a vaccine that we normally give to pregnant women, and that is the tetanus diphtheria. Yes, you understand, TT. We call it TT back home. So we give this pregnant women to help build their immune system against tetanus. Yes, and this particular vaccine, I think we have 5 doses that are usually spaced. You get, so you finish it for a very long period of time. Some people keep up with their appointments even after pregnancy. So if you are pregnant in Nigeria, if you've not had your tetanus diphtheria vaccine, I would advise you to speak with your midwife and find out how soon they can give you that vaccine. And also another vaccine that is being given in Nigeria in hepatitis, but this is based on 1 or 2 reasons. They don't just give everybody the hepatitis vaccine, but find out from your midwife if you need it and if they are likely going to give you. So that I am not fine. I'm not like conversant with as of now. But the one I was sure of was the fact that they gave that TT vaccine to all pregnant women while I was working. For the short period I worked as a midwife. I didn't really work as a midwife for a very long time, just a short period. Then also there's something I noticed back home when I was a midwife, is that we give some tablets that helps to prevent malaria. Yes, I think it's XP, they call it in abbreviation. So we give that particular tablet to pregnant women to help them prevent malaria. So these are the things they do in Nigeria. It's quite different from what they do in UK. And in Nigeria, they also give flu. I heard they give flu vaccine, but I didn't really witness it. Like I earlier said, I didn't practice as a midwife for long. You get, but I just do online midwife content. I didn't really practice in a hospital setting as a midwife, but rather practice as a nurse than a midwife. All right. So this is the difference between Nigeria and also the UK. So I got pregnant in UK, and this is what I personally received in the UK, and I have I'm here and I have shared it with you all. Please and please don't mind the break. You know, I'm pregnant, so my brain sometimes skip a lot of things. Anyway, thank you for staying tuned. Thank you for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Pregnant Nurse Mercy Mary saying thank you. Bye, and see you in our next video.